Hey everybody, it's Matt Shu from Upright Health, and I am joined today by Alex in Germany. So Alex is a user of the FAI Fix and somebody who had a lot of hip pain and still does have some hip pain. And I wanted to have him talk with us today and share his story because Alex actually had surgery for FAI and labral tears. And he's a pretty smart guy. He's done a lot of research on his own. And I thought just having him talk about his story would be really helpful for people out there who are dealing with hip pain. So let's jump right into it. Alex, hi, thanks for joining us.
What's
Tell us
up?
about yourself.
I'm Alex, 27 years old, and I'm living in Heidelberg, Germany. I think one of the most wonderful towns in Germany. So I think the main thing was a sort of pinching sensation in the upper anterior hip, I think, which is, I think now I would say it's sort of the TFL region.
Mm-hmm.
And I realized that I at the time I was climbing a lot, and for example in hip flexion, in hip internal rotation, which you do a lot in bouldering, for example, all these kind of movements were sort of hard to do and becoming harder to do after a couple of years.
And then in what year did you ended up getting did somebody say, oh, well, you have FAI and labral tears? What year was that? And how long was that after it started?
And that was 2013. And so that's 6 years after I first started to feel the problem.
Mm-hmm.
And so we did MRI and all that kind of stuff, X-rays, and then it was suggested that the too much bone on my hip was impingement, and that I had a labral tear and probably damage to the cartilage. Mm-hmm. They said, do it rapidly, because if you wait too long, and then you might end up with a replaced hip down the road, or you not might end up, but you will probably, or pretty sure, end up with a replaced hip.
Okay, so they said
so that was what they said.
Right away.
Yeah.
Okay.
Basically, they said it's better if you do it really quick, like as quick as possible, and that will be better for you down the road. Back at the time, I had university, so I could access all the journal articles and stuff, which was good. I mean, it helped me a lot to even sort of realize what the problem really is, and I think I got to understand the problem better. Mm-hmm. But also, I think in the end, it turned out that sort of the research I did was sort of biased in one direction. But based on that literature, I was becoming more and more convinced that surgery is indeed the best option. So I actually did both sides. Okay. So the first one was 2014. So you might question why did I do the second one? But after the first one, I thought there was like a slight improvement. Mm-hmm. As I still had surgery only on one side, I still thought that, like, psychologically it was difficult, because I still thought there's this bony problem and there's still too much bone, and if I do this, it will still make things worse. So as it improved a little bit with the one side I did surgery, I thought, okay, to get this sorted out and to move normally, I sort of have to fix this bony problem, and that includes both sides. So I did the second side as well. Like after the second one, I also, of course, I did exercises, I did foam rolling a little bit, I did a little bit of stretching, but I did it sort of in an unsystematic way, and I think I just didn't put enough time in, sort of. And only after I refound FAI Fix and I started the program, mm-hmm. I realized that it really just takes a lot more time to go into tissue, into stretching, into reactivation exercises, which still I think is a big part of why I still have some pain. The whole muscles that should work are not working 100% properly. Mm-hmm. And so that's where the shift came, that I realized surgery wasn't any fix, for me at least. I'm not saying that's always the case, but for me at least, it didn't change. I mean, I was still, when I was sitting in the car, there was a pinching feeling, sort of a pain deep inside the joint. It's really stiff, and internal rotation was missing and all that stuff. So for me, that was no option. But I think the major improvements are better even. I mean, I'm able to squat really deep, mm-hmm. for example, and do movements I wasn't able to do before. Nice. I can sit basically ass to grass, sort of still a little bit rounded back, mm-hmm. but it feels better and better. And I realized that as I'm doing these movements I couldn't do before, I start to gain regain mobility in other areas as well. So
awesome.
That's sort of a connected thing, and I feel like I'm generally improving. So that's the greatest achievement, to actually think that I'm now able to move like I should be able to move, like doing things that are actually normal. And
yes.
and now this is the best improvement actually for me. I think the central thing is, and this is I think very clear in the FAI Fix, that, like I said just before, that you really have to be willing to put the time in. And I would say, don't do surgery unless you have tried everything else, and by that I mean like really put a lot of time and effort in, and also like have the awareness to see what's wrong in your body and to try to fix it. And if, let's say, you do it for a year and you do it daily and you do reactivation exercises and you do mobility exercises, and you still feel no improvement at all, which I think is not going to happen, then maybe you could go back and reconsider. I'm not saying doing, but reconsider surgery.
Right.
Because I just don't think that, I think there is people out there who would say their hip improved after surgery. So I'm not totally saying this is going to be an option, but for somebody who has the same diagnosis as I had, I would say don't do surgery, do everything else before, and it's going to help you. Like things like the FAI Fix and all the exercises in it, they are going to help, and they're going to help actually quite quick, to be honest.
I mean, did you find it that quick for yourself? Because not everybody finds it's like, ooh, amazing, right? So a lot of times there's trial and error. Like, what was your experience?
Yeah. I mean, the thing is, the good thing about these exercises, I think, especially the ones with mobility and stretching, is that you get pretty quick feedback. And if you do something that improves, then work on that a little bit more. And I think that's the good thing about it. And for me, it takes longer. I mean, I'm still working on it. But it just gets better and better, as I said. Like, I'm able to do things I wasn't able to do 2 months ago now even. So I think now I wouldn't have needed surgery or felt that I needed surgery if I did the same things I'm doing now, which now feels almost stupid to say, because I could have done more research and better research and stuff. But maybe I'm only able to say this because I went through all I experienced.
So guys, hopefully you found this video helpful, you found Alex's perspectives helpful, and you found it inspiring, since he's actually making progress with his body even after the surgery. So if you're somebody out there with hip problems, take this as another piece of information, another data point for yourself, and think about, what this could mean for you and whether you can make the improvements yourself with your own body by working with mobility and working with muscle. So that's going to do it for this video. As always, we hope you remember that pain sucks.
Life shouldn't.